Good afternoon. Today is Wednesday, January 29th. This podcast is brought to you by LifeSpan Network, and my name is Dana Kaufman. Thanks for joining us. Today is actually LifeSpan's Legislative Day in Annapolis, so we have over 50 members coming down to meet with their legislators and talk about their communities and the challenges that have been presented to them over the years, and to just give the legislators an overview of their thoughts on some of the legislation that has been put forward by the General Assembly. Last week was a big week because the governor did introduce his fiscal year 2015 budget. That budget did include two rate increases. Nursing homes did receive a 1.725% rate increase, and medical adult daycare received a 2.5% medical rate increase. 2.5% rate increase. Unfortunately, unlike in years past, those rate increases are only for a half of year and do not take effect until January 1st, 2015. Also in the governor's budget, what's called the BRFA bill, there is a provision that is part of the new hospital model design, the waiver that the state has been working on that was approved by CMS, and it is to create community partnerships between hospitals and community-based providers. This year, $30 million will be allocated to the program, and in future years, it will be $40 million. So we are looking at that provision, and LifeSpan does support it. Along the same note, as you know, like I just said, CMS did approve the state's redesign for our waiver program, and the CCRCs has appointed an advisory council to work with the state on implementation of that new waiver design. 4 work groups have been established, and LifeSpan does have 2 representatives on that work group. Bill Holman, the CEO of Charles County Nursing and Rehab, will be on the performance measurement work group, and myself will be on the physician alignment and incentive work group. LifeSpan, on that same note, is putting together an internal work group to be looking at these issues. So if you are interested in working and participating on our internal work group, please send us an email and let me know. We're looking for great participation for this important program. As part of kind of going towards the same budget theme, the governor has put his support, as you probably have heard in the paper, behind raising the minimum wage. It would be raised in a 3-part series beginning this July. The minimum wage would go to $8.20. Next July, it would increase to $9.15, and then in July of 2016, it goes to $10.10. After July 2016, increases would be tied automatically to the CPI index. So we have asked our members to please take a look at your operations. Let us know the impact that increasing the minimum wage would have on your operations, and send us that information so then we can work with our policy committee to formulate our position. Kind of leaving the budget issues and going to some legislation, we are tracking several pieces of legislation, but we do anticipate more coming down the pike. This is an important week because this Friday is the Senate introduction date, and next week is the House introduction date. So we do anticipate many more bills being introduced over the next 7 days. Some bills that have already been introduced include a bill that would require CCRCs that offer Type C contracts to have to perform and conduct an actuarial study every 5 years. Current law only requires those who offer a Type A or Type B contract to perform an actuarial study every 3 years. So this is much different for the Type Cs. There's also a bill that has been reintroduced that we opposed last year that would require related institutions to develop a workplace violence prevention program and plan. And there's also a bill that has been introduced that would require the Department of Health and Mental Hygiene to establish a database of direct access employees. This bill is being put in in place of the bills that have been put in years past regarding the abuser registry program. We are also anticipating again that there will be bills put in on sex offenders residing in assisted living and nursing homes. The House Health and Government Operations this week held its third briefing on this issue. So it's unclear the direction that the committee is going to go, but it is clear that that issue will continue to be debated. And then finally, we are still waiting to see if the Office of Healthcare Quality will introduce legislation mandating the Maryland background check program. So as you can see, there's already been a lot going on, and it's just the beginning of session, so we do anticipate more. And we hope you tune in for future podcasts, and we'll keep you updated as the 2014 session marches along.